Okay, so Si, thank you for coming along and having a chat today. Just because it's going to be extensive, I'm sure. If you want to let us know who you are, where you're from, what you do, what your kind of background is.
Well, basically, I'm from Malaysia. I moved to the UK about almost about 6.5 years ago. Consultant psychiatrist in the UK, general adult kind of a concept. I'm also the chair of the Royal College of Psychiatrists in the Southwest. I'm the chair of the mental health approval panel in Midlands and also Southeast as well. Um, yeah, basically at the moment now, just doing a little bit more of freelance work and just enjoying my life at this point of time.
Busy
Yeah,
man, though.
a little bit busy, I would say.
Busy man. What got you into psychiatry?
Well, I was always intrigued, the gray area of things in life. If we go to a surgical thing, this is what I need to do. I need to operate. Ortho, we have got lots of things, very kind of black and white kind of a concept. So I like psychiatry because it's very, very gray. It's all got to do with the mind. And I was always fascinated with the mind and the chemical imbalance in the brain, how actually it works and how people get triggered with things, how depression, anxiety, stress. So I was just very intrigued about how the brain actually works. So that was the thing which I was very fascinated about. And yeah, this is how I just joined psychiatry. I felt that it was something I need to learn a little bit more, human behaviors and everything of those. So I decided to pursue psychiatry. Yeah.
Is it an emotionally draining kind of role, or are you able to approach it as a clinician?
I think I wouldn't say it's emotionally draining, but sometimes, when you look at things, how it's working in the UK and comparatively to back to home in Malaysia, it's a little bit more, how would I say that, the waiting list seems to be very, very long. And just to see a psychiatrist and someone professional to an extent, it seems to be taking quite a huge amount of time. And during that period, they're not getting enough support. So I'm just feeling for them in that sense that, how are they managing during that point of time? When they come to us, it's probably they've not been diagnosed, and for some time they've been struggling and then trying to get services on board, but it's just so difficult because everywhere is stretched to an extent. So this is the whole concept of just looking at their, I would say the word suffering is a very good term to use, that period when they were suffering in the terms of, the stress, the level of anxiety they've been going through. I feel a little bit more upset that, I couldn't do much.
Do you think that addiction is on the increase because of self-medication, because of lack of access?
Yeah. What else are we going to turn into? Right. We've got no access at the moment now. We're struggling to get access. Waiting list is too long for any single thing as well at the country at the moment now. The only pathway people can look into is just to de-stress themselves. And, there's positive coping skills and there's negative coping skills. It just depends on how you look into life's perspective, And most of them, dwell with drugs, alcohol, to an extent where, they struggle. You just go into a cycle. And most of them, when you speak to them, it's like, Saya, I didn't want to do drugs, but, I didn't have the support. So just to ease my burden at that point of time, I did drugs.
Yeah.
Yeah.
I mean, the vast majority of the clients that we see in Gladstones are self-medicating and emotional or psychological problems.
Sure.
Specifically anxiety, depression, often.
Yeah.
Really often.
And even ADHD as well, because your brain runs, it's like kind of a concept, it's just ongoing flight of light, just continuously, and you just need something to dampen that down.
Yeah.
And then, people resolve in drugs and alcohol just to dampen those kind of thoughts.
Well, and interestingly, the treatment, the medicinal treatment for ADHD is quite often an amphetamine.
Exactly.
So it has a different impact on a brain with a person that struggles with ADHD.
True.
And so it seems to actually help.
The thing is that people tend to Google, methylphenidate, dexamphetamine and everything. The term is already there. Oh, why am I going to a doctor or why am I going to a psychiatrist? The medications he's going to prescribe is something which I can get it in the streets. And perhaps much more cheaper. I don't know. I've never tried it, so I don't know. But to an extent, to get a diagnosis before anything started, that's going to take you about 12 months.
Long time.
Long time. So what am I going to do in that meantime? So they dwell into drugs.
So for the statutory services that are available are few and far between, and they're being cut all the time.
Yeah, the fundings.
The funding is not there
Yeah.
anymore. So that, one option is to go private. Now, a lot of people seem to be going further afield for private treatment. So, there are a number of treatment centres in Asia.
Yeah.
For example, South Africa. Is there a difference, do you think, between treatments abroad and treatment in the UK?
The general concept of treatment is almost similar everywhere you go. We abide to, nice guidelines and everything of those. The general treatment is the same. But I think the difference, what I feel is that when you start paying for something, you're much more committed to it.
That's
when
true.
you get something for free, you take it for granted.
Yeah.
That's the problem. So now you start thinking, oh my God, 28 days detox, right? I'm paying a day, I don't know, £200-300 or something on those lines. I'm not certain how much the private sector charges, but and you start saying, oh my God, I'm paying £300-400. I need to get better. I need to get better. I need to come off this entire thing. So the first thing is the concept, the mind itself. That's a very strong thing to think about, right? So when you start paying for something, it's much more easier for you to, your concept in your mind, your psychological level and everything changes. You're open to it. In Asia, things are much more cheaper. To an extent, it's I would say probably fraction of the price.
Right? It's about half, I believe.
Yeah. To be honest with you, and what happened most of the time is actually people travel to Asia just to get those treatments because there's a fraction of prices. It's very clear. And the other part of it as well, it's more of dwelling into the new version of medications. We're quite stuck upon things, if you're not up to date on things, on journals, on research, we have this thought, let's treat them with something which we feel it works. If your knowledge into addiction medicine, it's limited, and that's the only medications you're going to treat them with. We're still utilizing, let's say for antidepressants and everything, we're still utilizing the olden days drugs like, citalopram and everything of those. And that's something which we need to think about, if at all we have something different. Yeah, moving on with that.
Is that around licensing of the drugs?
Yeah, that's one of the things as well. And the price factors into every single thing as well. So my concept, when I was in Malaysia, I did my fellowship in addiction medicine in Malaysia, right? And the difference which I felt that there was a lot of family support. There's lots of family support. That's social expectations. There's lots of family support there. And one thing differs here. It's lots of families are estranged. So that's one thing. The community supports one another. And I feel that's very, very crucial for every one of us. As long as we understand this adequate amount of support, things are very, very different then.
Yeah, we were just, Dave Barker and I were just
talking
about that.
It's a fellow colleague of mine,
want to change the world.
If
only. But as I was saying then, the treatment of addiction really, the support network is immensely important. Immensely important. The sense of connection is immensely important. And for somebody who's in active addiction, that disappears because you're connected to a substance rather than your community, your family, whatever it might be. So that's, you're starting from the back foot, but the actual responsibility for an addict to get well does lie with them. And I think it's important what you said about, when you have invested your own money into a process, then, I think your commitment level is higher, is greater.
Increased.
Yeah, which does mean that your motivation is better.
Exactly.
In order to do it.
You want to get better.
Yeah, absolutely. And I think that there is a difference between, what treatment centres that are funded versus private treatment centres. But, my question for people who do go to, away from the UK in order to seek treatment is what happens when they come back to the UK.
So this is the struggle. See, I think this is a struggle with any private psychiatrist or even private addiction centers as well, What happens is that when you move to Asia, you get your treatment, you get your detox, and you come back here, we don't recognize things. So we said, nope, you're going to start back in square one. Most of the time. I've seen a lot of things, when a private psychiatrist diagnosed a patient, no one wants to acknowledge that.
Right.
So that all of us are still under the GMC, we're still acknowledged by the Royal College, but it's just that it differs kind of a concept, how people think about that. So when they move over back here, the addiction starts back again, kind of a concept, And then the whole, it's just a very cyclical process, if you see what I'm saying. A lot of things are not recognized, If you're coming from Asia, you did your detox 28 days, 6 months, 3 months, depending on how you think is suitable for you, and you come back here, the support is not there anymore.
That's where it doesn't make such good sense to me. I had a client a little while ago who'd done treatments in the sunshine, in a fabulous place in the sunshine, and came back and was okay for a period of time, unfortunately relapsed, and then got in touch with us and we spoke about it, and he said it was the support afterwards, because rehab, as you know, is not a cure.
No.
So it's a commitment to actually engage and continue to engage in whatever form that might be in your recovery. So I think that's difficult.
Very. And I would say the process, psychological response, you need a really good psychologist, there with you, who's invested his, her, they, or them, kind of, like their mind, soul, the body, every single thing, they're invested in it, and, they'll sit down and they feel that they can make changes. Although they're not going to make huge changes in terms of the national picture, but as you sit down with a patient or client of yours, if you believe that you can make changes for him, her, they, or them, right? And when you're invested in it, you will make it happen. You will make it happen.
Yeah. I think also, if certainly from my perspective and my experience, really strong bonds are formed with clients in treatment, which can be very healthy and positive, or kind of
vice versa.
Way. But you're also introducing people to what is available in their local area in terms of continued recovery. What have they really connected with whilst they're in treatment? And it can be anything from the therapy to yoga, or something, something that they've really engaged with, they want to continue doing, and actually it's going to form part of their recovery moving forward.
I presume, in Gladstone's clinic, kind of a concept, you've got your clients and everything. Do you have those Zumba yogas and
we do? We don't do Zumba. I think that's probably a little too high energy. But we do yoga. We do mindfulness. We do reflexology. We do equine therapy. Which is, a wonderful magical thing. All of those are really about emotional regulation and being able to just be present.
So it's more of person-centered kind of a thing here we're looking to. So every individual has their kind of a person-centered kind of way of treatment.
So there are various things that all of our clients have to do. So various assignments that are really, so things like identifying in your childhood. We don't ask people to relive trauma, but we do ask people to identify maybe where their thinking changed. And often I'll talk about when some kind of trauma happens, when your response is your ego goes up and your barriers come up and you push people away and you don't trust, but your self-esteem is left on the floor.
Shattered,
So the ability to ask for help when you're actually within that area is now impossible, because you don't want to admit that you need help.
I was just wondering a little bit. I know that you're supposed to ask me all the questions, but I was just wondering,
we can chat. Let's chat.
Why not? I ask a couple of things so people are aware, in such an extent as well. Example, as we said that, it's all self-medication kind of a concept. Most of them, majority of them, I would say, kind of a thing. And although you provide those kind of psychological support, medications and everything, do you diagnose, different kind of mental health, let's say for anxiety or depression, someone comes in, right?
If somebody is generally already diagnosed.
Okay.
And we won't alter their medication because they have
Yeah.
had a diagnosis. We're not a mental health unit.
Okay.
We're not a psychiatric unit, although
Okay.
Dave Barker is our clinical lead.
Yeah.
So, if we need to call on him because somebody's struggling in a particular manner, then we will. But, the process is quite small in a treatment centre. Generally our clients are with us for 1 month, 6 weeks.
Okay.
So
Is it privately funded? Is it funded by the ICB? Okay.
Yeah, privately funded.
Okay.
So, a lot of Dave will come in and assess, and have a psychiatric
Yeah.
assessment
Yeah.
with individual clients, depending on what they're needing
Yeah.
and how they're presenting. But we will have maintained any kind of mental health medications that they have for anything they've been diagnosed prior. So we're really looking at a detox and therapy, I remember Dave telling me once that he did a study with 100, I think it was 100 male alcoholics, who 80% of them, when they attended the detox treatment, had been diagnosed with depression, whereas the actual number was 20%.
Wow.
There is, alcohol is a depressant.
And this is the thing which I'm kind of intrigued about, We know that you're self-medicating. Why are we not treating the primary cause?
Well, because, as you said, the weight, the access to those services, all of that. But, often it's, people are self-medicating an emotional issue rather than a mental health issue.
Sure.
So, and really the only course of treatment for that is to address it, is to speak about it, is to learn
Opening
how
up.
to manage it.
Yeah. Sure.
Yeah.
Sure.
So we were talking about, you come from Malaysia.
Yeah.
Is there a kind of cross-culture addiction, that differences between?
I think it's just the terms of drugs which is used in Malaysia and the UK. It's a little bit more different, in terms of heroin addiction, it's a little bit more in Malaysia as well. It's much more common. It's much more cheaper.
I suppose it's, yeah.
Yeah, it's much more common, much more cheaper. And
although highly illegal, isn't it?
it is. It
Yeah.
is. It is. It's highly illegal. And the best part of it that, when moving to the UK, I remember that one of the most things, like, everyone was talking about cocaine, and it was like, it's like a party drug. And I was like, okay, isn't cocaine expensive? Oh no, sorry, you can get it quite cheap. And I was like, how can you get it quite cheap? So what they tend to do, they tend to mix with a lot of things into it and sell it as cocaine, but actually it's not pure cocaine. And I was like, okay. And that worsens the addiction because the potential of things being in like drugs itself is just escalated very quickly.
Yeah.
It's just surprising, when I look back home in Malaysia, and I consider the UK my home at the moment now, but yeah, when I look back home in terms of Malaysia and how we started methadone and everything of those, it was really surprising. We started in the mosque and then slowly we expanded. Malaysia is a Muslim country anyway, so we started in the mosque and very diverse by it. And then we slowly expanded to everywhere else with our centers for addiction. And I did my fellowship in addiction medicine in Malaysia, and I learned a lot. And people are much more. We don't have extensive psychological process back home, and I always wondered, if at all we were to build in that psychological thing back home, it'll be much better for them as well. And that's the one difference. In terms of medication wise, it's the same, I would say, right? But in terms of, if you're looking at treatment on an overall or holistic approach, we might not have those kind of facilities back home, kind of thing. Yeah, it's just.
It's, often it's said that the drug, the alcohol, the heroin, whatever it might be, is what you're using to treat an actual underlying cause. From my experience, it took me a very long time to get clean, a very long time, because I always thought it was just the physical addiction. So give me methadone, I'll be fine.
Yeah.
No.
It's the psychological addiction as well, which is one of the most difficult thing to help with.
Yeah.
The physical addiction, we can manage it with medications, right? But the psychological addiction, when it's more like in the fact, how vape and everything came into picture and in business, I presume. It's the habit of picking up a cigarette and placing in your mouth, right? that's why you keep placing the vape constantly. You know, you must be smoking more vape, you know, than the whole thing. Yeah, you
I
realize
switched. I switched from cigarettes to vapes. It's in my hand constantly.
Yeah, you just need it. Like, you know,
Constant.
and
It's
then you
like a
start-
dummy.
Exactly. And it just starts feeling that, okay, am I actually smoking more than I'm actually smoking, by the way? The thing is, I'm just quite surprised. Like, if you see someone holds a vape, like, you know, wow, okay, it's like, it's constant.
Yeah.
It's constant. Like, every second you speak to them, it seems to be they're just vaping. And I'm like, guys, what's going on here? You know?
Kind of, yeah.
Yeah.
My experience is kind of worse. But then you're right. You know, there are certain things that are very habitual.
Yeah.
And then there are other things that really do change the way that you're feeling.
True.
You know, can calm you, can make you more excited, can whatever it is. I'm not
Yeah.
convinced nicotine does that for me anymore. But there you go. I think it's just a habit I need to put down. But you mentioned interestingly the mix, you know, drugs being cut with other drugs at the moment,
Yeah.
and there's a big problem at the moment with some very dangerous cutting agents that are going around. There are a lot of ODs going on.
That's the worst thing, you know. I mean, America, if you look at America, there's much more comparative to the UK as well. And you'll realize that, oh my God, where are they getting these new ideas of mixing drugs and making it more addictive rather than anything? It's like the concept where I don't want to go through the drug dealing processes. You know, the thing is that where are they getting these ideas? Like, you know, why don't we drop the level of cocaine down, the percentage of cocaine, the pureness of cocaine, and then add more things into it so we get them hooked?
Well, a lot of it. I mean, I went to see somebody speak on this, a professor speak on this, and it was about, you know, prohibition. So we're still in prohibition. That is our drug law in this country, and certain countries who have actually changed that law have got better treatment. We're not there yet. But, you know, interestingly, he was saying that, you know, it started with, you know, you went from opium to morphine to heroin to methadone to subdose, etc. The most interesting one that he mentioned that really struck me was that it never used to be illegal to smoke cannabis in prison. It changed, and anyone who was tested positive for cannabis would have their sentence increased.
Yeah.
So I suspect it always was illegal, but it was, you know, suddenly this process started happening, testing for people, your sentences increased.
Yeah.
So every new drug that comes up is not classified. So spice was introduced, wasn't classified, so therefore not illegal, if you like. And so each new drug that has come out, that's the reason, is because it's not classified. You can get away with it for probably a year because it's going to take a year to classify. And it's even more harmful than the one before.
True. Very true. Very, very true. And the other factor of it, you know, as you're aware, you know, I presume that you are aware of this, that a lot of countries are now legalizing cannabis.
Yeah.
Right. And in the UK, although it's unlicensed, but, you know, you can see a lot of companies actually opening up, you know, helping people with, you know, self-medicated, you know, kind of thing on cannabis usage and everything of those. If you were to ask me, Sai, what's your thoughts in regards to that? I would say, you know what, I don't have that much of evidence, you know, thinking about this in the sense that, you know, I've not read up to an extent to give kind of a definite answer to it, you know. I'm in the process with Dave as well, and I was having conversations with Dave, and Dave, you know, I've read through lots of research, shows two types of research, right? We've got lots of research funded by, you know, pharma companies, and you've got research done by, you know, consultants and everything of those. And there are some contradictory things over here, and some support, some doesn't support, right? But you can see more and more research are being developed at this point of time to say, you know what, cannabis is one of the pathways to move on to, you know. And lots of countries, you know, Thailand has recognized themselves, you know, Amsterdam and Holland, I mean, I don't know where we stand at this point of time in regards to that.
I mean, do you know, all of, you know, most of the drugs, it as an addiction treatment that we treat somebody who has become addicted to are used pharmautically to alleviate, you know, other pain, what be it, you know, anxiety, whatever it may be. I suppose that the key question is, you know, is the addiction versus holistic treatment.
Sure.
You know.
And Tiff, I'm going to ask you a question over here, right? Are you replacing one drug to another?
I think addicts do. From my own personal experience, I did. I gave up heroin. I started drinking.
You're just replacing one
Yeah,
to another.
I can't do any of it. You know, but I think that moving forward there will be a lot of research done, and a lot, hopefully, decriminalisation at least of certain substances, so that more funding can actually be put towards treating addicts.
I think that'll be the future then.
Yeah.
In that sense, I'm not saying I'm in support or not in support, but let's see what research shows.
Absolutely.
Yeah.
Absolutely. And there's some incredible research going on, and I'm sure that there will be a lot of help for a lot of people.
Yeah.
I think addiction remains.
I'm quite keen to actually visit Gladstone's, to be honest with you. I heard it's in Cotswold, is it?
Yes.
Yeah.
Yeah.
Very beautiful place.
It's a very beautiful place.
Yeah, I'm quite keen to actually, because Dave was asking me, "Si, why don't you come down and have a look at what we do?" I'm quite keen to look into that.
Absolutely.
Yeah.
Absolutely. You're more than welcome.
Perfect then.
Pleasure to meet you.
Thank you, Tess.
All
You
right,
have a good
thanks,
day
Si.
then. All right.